I mentioned how I was for universal health care. And this person here says, you're for universal health insurance. We all have access to health care, but not health insurance. Healthcare and health insurance are two very different things. And I agree that healthcare and health insurance are two very different things. But no, we do not all have access to healthcare. I know that we think we do because we've had laws in place since the 80s that say that emergency rooms have to take you, you have to be treated. That is not the case. People in this country die all the time because they do not have access to the proper health care. I know people in my personal life that have not been able to get the treatment that they need over the course of their lifetime because they don't have adequate health care and because the hospital turned them away. We do not have adequate access to health care. And so, no, I understand what you're trying to say there, that what I want is coverage. Everybody should be covered, but we already all have access. If we already all had access, there would be no need for universal health care. If people weren't dying, if people weren't going broke, if people weren't suffering financially and physically from a lack of access to health care, I would understand what you're saying. But that is the case. People are dying, people are suffering, people are going broke. So no, I want universal health care. Universal health care is universal coverage. Everybody gets to walk into a doctor, everybody gets to walk into a clinic, everybody gets to walk into a hospital or a pharmacy and get the care that they need. If you want to call it health insurance, then we can call it health insurance. A lot of people call it Medicare for all, whatever it is. We do not all have the same access to health care. We just don't. And so what I want to do is I want to do away with health insurance. I want to destroy what's left of the health insurance industry to the best of our ability. People that have made billions of dollars off the pain, suffering, and death of others. People who have denied coverage to people who have paid for years and years and years into their health insurance plan. Whatever we want to call that, we can call it whatever you want to call it, but it's definitely not universal access to health insurance. It's universal access to health care. Everybody should be able to walk into the doctor and say, this is what's wrong with me, and get care. Everybody should be able to walk into a hospital or take an ambulance ride to the hospital and get the care that they need. No matter their financial situation, no matter if they're employed or not, no matter what their health conditions are, everybody should be able to access the care, and we just don't have that in this country. I'm sorry, and there are going to be people that are going to come into the comment section and tell you some stories of their own, most likely, and explain that that's just not the case. There are thousands, if not millions, of people in this country that just do not have access to health care. Oh, anybody can walk into a hospital and get care. That is not necessarily true.